Have you ever noticed your scalp feeling sore at the same time as your hair seems to be thinning or falling out? That combination can feel alarming, but understanding what's behind it is the first step towards getting the right help. Before we dive in, this video is for general information only and doesn't replace advice from your GP, pharmacist, or dermatologist. If you're concerned about your symptoms, please do speak with a healthcare professional. So, why do a sore scalp and hair loss sometimes happen together? The two symptoms are often connected, and the causes range from common inflammatory conditions to things that need more prompt attention. One of the most frequent culprits is seborrhoeic dermatitis, an inflammatory skin condition causing redness, flaking, and itching. The hair shedding that comes with it is usually a secondary effect of the inflammation, and importantly, it's typically reversible once the condition is treated. Scalp psoriasis is another possibility, producing thick, silvery plaques and significant discomfort. Like seborrhoeic dermatitis, the hair loss associated with it is generally non-scarring, meaning regrowth is possible when the underlying condition is managed. Allergic contact dermatitis is worth knowing about too. This is a reaction to something that's touched your scalp. Hair dyes are a common trigger, particularly an ingredient called paraphenylenediamine or PPD. Patch testing can help identify exactly what's causing the reaction. Then there are fungal infections. Tinea capitis is a fungal infection of the scalp, and in some cases it can develop into something called a carrion, a painful, boggy swelling. This is an urgent presentation because without prompt treatment, it can lead to permanent scarring. That brings us to an important distinction: scarring versus non-scarring alopecia. In scarring conditions, such as lichen planopilaris and frontal fibrosing alopecia, the hair follicles can be permanently damaged if the condition isn't treated in time. Early referral to a specialist really does matter here. Alopecia areata is different. It's an autoimmune condition where the immune system mistakenly targets hair follicles, but it's classified as non-scarring, so regrowth is possible. There are newer treatments available for severe cases, including JAK inhibitors that have received MHRA approval, though these are specialist prescribed medications, and whether they're suitable for you is something a dermatologist would determine. If you're thinking about treatments for male pattern hair loss, it's worth knowing that finasteride used for this purpose is generally not available on the NHS and often requires a private prescription. Your clinician can advise on what's appropriate for you. When you see your GP, it helps to think about when your symptoms started, whether the soreness came before or alongside the hair loss, and whether you've changed any hair products recently. Initial blood tests in the UK typically include a full blood count, ferritin levels, and thyroid function, because conditions like iron deficiency and thyroid disorders can also contribute to hair loss. One practical tip: if you take high-dose biotin supplements, let your clinician know before any blood tests, as high-dose biotin can interfere with certain results, including thyroid function tests. Now, when should you seek help more urgently? Contact your GP promptly if your hair loss is progressing quickly, if you're noticing smooth bald patches where the scalp skin looks different, or if you have other symptoms you're worried about. And seek same-day care if you notice a painful, boggy swelling on your scalp, particularly with fever or swollen lymph nodes, as this could be a carrion requiring urgent treatment. If you're ever unsure, NHS 111 can help you decide what to do next. To recap, a sore scalp and hair loss together can have a range of causes, from common inflammatory conditions to fungal infections and autoimmune disorders. Some respond well to treatment, while others need prompt attention to prevent permanent damage. Whatever the cause, a healthcare professional is the right person to guide your diagnosis and next steps. If this video has been helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, please give this video a like and subscribe to the Bolt Pharmacy channel for more medically reviewed health information.